Down syndrome. Down syndrome is a genetic disorder that occurs in 1 out of 800 live births. It is the leading cause of cognitive impairment. It associates with mild learning disabilities, developmental delays, facial features, and low muscle tone during infancy. Down syndrome can also have heart defects, leukemia, Alzheimer's, gastrointestinal issues, and other health issues. Down syndrome is also called trisomy 21. Down syndrome is a genetic disease that occurs when a person has 47 chromosomes instead of the usual 46, resulting in problems. Trisomy 21 causes problems on how the brain and body develop.
Every cell has a nucleus, the place where genetic information is stored. The nucleus has 23 pairs of chromosomes, half from each parent. The most common way Down syndrome occurs is through non-disjunction, an error in cell division. Chromosome 21 is replicated into 3 copies instead of the normal 2. A pair of chromosome 21 fails to separate in the sperm or egg. As the embryo develops, the extra chromosome is replicated in every cell. This is called trisomy 21, and 95% of all Down syndrome cases occur from this. The other two ways Down syndrome occurs is through mosaicism and translocation. Mosaicism is basically the same thing as non-disjunction, except it takes place in one, but not all, of the cell divisions after fertilization. This results in the mixture of some cells with the normal 46 chromosomes and others with the abnormal 47 chromosomes. This only accounts for 1% of Down syndrome cases. Research shows that this type of getting Down syndrome can result in fewer complications or characteristics of the syndrome. The other way Down syndrome occurs is through translocation. Translocation accounts for 4% of all cases of Down syndrome. In translocation, part of chromosome 21 breaks off during cell division and attaches to another chromosome, usually chromosome 14. The total number of chromosomes is still 46, but the extra part of chromosome 21 provides the Down syndrome characteristics. Regardless of how Down syndrome occurs, each way all results in an extra chromosome 21.
Down syndrome can result in multiple physical symptoms. They can vary from mild to severe, but most people with Down syndrome have a common, widely recognized appearance. Many people have a smaller, abnormally shaped head. The corners of the eyes may be rounded instead of normally pointed. Infants could have decreased muscle tone at birth. Extra skin may be present on the nape of the neck, and some other facial abnormalities include a flattened nose, smaller ears and mouth, and possible white spots on the colored portion of the eye. It is also possible that the hands have only one crease on the palm, and the hand might be wider and shorter, shortened fingers. People with Down syndrome also suffer from various mental and social symptoms. They might have rather impulsive behavior, and people with Down syndrome may also have a harder time learning, have a lack of judgment, and have a limited attention span. Furthermore, some people may also feel constant anger, frustration, or sadness once they realize the restrictions imposed on them due to Down syndrome. Furthermore, Down syndrome can result in various medical symptoms. They can result in birth defects with the heart. Some may also have dementia, a loss of brain function. Dementia is greatly possible for those whom age. Cataracts, a clouding in the lens of the eye, is also possible for some. People with Down syndrome may also suffer with massive vomiting from gastrointestinal problems. Other problems may be hearing difficulty, hip problems, a high risk of bone dislocation, chronic constipation, and an increased risk of leukemia. Teeth may also appear later and in places that create issues when chewing.
People with Down syndrome have a shorter lifespan than that of most other people. The average lifespan for a person with Down syndrome is around 50 to 60 years. This is due to the premature aging that unfortunately occurs to people with Down syndrome. Today, people with this disease are able to live regular lives due to advances in today's technology and medicine. Infections can be cured with medicines, and surgeries can correct other problems such as heart, intestinal, and other types of problems. People with Down syndrome, however, may need special help, such as therapy and special education classes for those with learning difficulties. Overall, people with Down syndrome can participate in most normal activities that the population does. Down syndrome is permanent. It stays with you for the rest of your life. There's currently no cure available. However, a couple of treatments are available. Surgery is one of the most common treatments for some of the defects from Down syndrome, such as the heart defects and gastrointestinal blockage. Joining an intervention program would also be helpful. Furthermore, various types of therapy can help people with Down syndrome. Behavioral training can help relieve constant frustration, anger, and compulsive behavior. Speech therapy can help improve your language skills, and physical therapy can help with your movement skills. Occupational therapy may help people who need help with feeding and performing tasks.
There is no 100% sure way of prevention. However, there are ways to lower the chance of Down syndrome. For one, a strong correlation has been identified between the age of the maternal mother and her offspring having the disease or not. In other words, the older woman, the higher the chance her children might have the Down syndrome. Older egg cells have a higher possibility of improper chromosome division. The chance of a woman's child having Down syndrome at age 35 is 1 out of 400. However, it is a 1 out of 35 once at the age of 45.
Various tests can help identify chances of Down syndrome during pregnancy. Screening tests can help discover if one has a high risk of carrying a baby with Down syndrome. Ultrasound, or nuchal translucency screening test, measures a region on the baby's neck. If there are lots of fluids in this area, it may mean abnormalities are present. Also, blood tests can help identify problems. Blood tests can measure levels of PAPPA, a protein, and HCG, a hormone, in the blood. Abnormal levels of any of these can mean there is a high risk of a problem occurring with the baby. Other advanced testing, like CVS or chorionic villus sampling and amniocentesis, both involve the extraction of amniotic fluids or cells and analyzing the fetal chromosomes. 5 interesting facts about Down syndrome. Did you know Down syndrome is the only trisomy compatible with life? Out of 90% of trisomy 21 cases, the additional chromosome comes from the mother. Down syndrome was originally described in 1866 by John Langdon Down. In 1959, Jerome Lejeune discovered it was caused by extra chromosome 21. Life expectancy with people with Down syndrome greatly increased from age 25 in 1983 to around 50 to 60 today. 2 out of 3 people with Down syndrome enjoy drawing or painting pictures. And Down syndrome is not related to race, nationality, religion, or socioeconomic status.